Sharmila ji, Surinder ji is not there. You're on mute.
Yeah, Ajay, he is in the meeting.
Okay. I was hoping he could just join us at least for the initial part. Okay.
Okay, let me just see. Let me go and check. Actually, he's still talking to somebody on the phone. I mean, let me just go and
I
ask
think
him.
our chief guest is just joining. So maybe we can.
Okay, let me ask. Let me.
Welcome, Dr. Manal.
Good afternoon.
Good afternoon. So, Natasha, I think we can start. We cannot hear you. We can't still hear you.
Ajay,
Yeah.
Ajay.
Yes, ma'am.
Yeah, he is here for a minute. If you want, you can talk. Ajay. This background hand. Ajay wants to talk.
Hello, sir.
Hello. Hi. Oh, I couldn't see you. Hi. How are you doing?
I just wanted you to be there at least for the initial part. Dr. Manal is here, so I thought, okay, maybe
Thank you.
we
Is
can
she here? Dr. Manal here? Hi, Dr. Manal.
Hello. Good afternoon, Jane. How are you?
No, I'm good. How are you?
Alhamdulillah, I'm fine.
Thank you very much. Thank you very much for joining us.
You're welcome anytime.
Thank
Nice
you.
to be there with you in this event.
Thank you. Thank you, doctor.
Okay, Natasha. Still, we can't hear you.
Please.
Want to try on the phone, maybe? Technology.
Hello, can you hear me?
Yes, we can hear you now.
Okay, sorry for the glitch. Okay, so good evening everyone. On behalf of the Executive Committee of BCICI, I extend a warm welcome to all of you who have logged in with us today. I'm CA Natasha Gopalakrishnan and I'll be your MC for the day. As you're aware, in line with the BCICI theme of the month, Health and Fitness, today's session is on breast cancer awareness. This session has been jointly organized by the Women's Wing of BCICI, the C2A Toastmasters Club, and American Mission Hospital. For our first address, I invite Ms. Maya, the president of C2A Toastmasters Club. Ms. Maya.
Good evening, ladies and gentlemen. Am I audible?
Yes, you are, ma'am. Good evening.
Yes, you are.
October always brings smiles and cheers in my life because it happens to be the birthday of yours truly, myself, and many of my friends. It also happens to be a festive time in the Hindu calendar. A couple of years back, though, October caught me unawares on a very topical issue. My mate reported that she had breast cancer and she had to start on chemotherapy immediately. She had been working relentlessly for a family that was based in Andhra Pradesh in India. She had been hoping to educate her 3 children and help them progress in life. But this discovery came as a shock, not only to her, but also to me. She started her initial treatment here, but then went back to India for good. That incident made me realize that, like her and many other women, even I am vulnerable to breast cancer. I made one resolution: live today like there is no tomorrow. I decided to utilize all those opportunities that were there in front of me. I write short stories and poems and wanted to try my hand at public speaking. A speechcraft program happened and I joined it. That encouraged me to go ahead and join a Toastmasters club. A new all-women's Toastmaster club was formed in June 2019 by Chartered Accountant and Distinguished Toastmaster Raghu Iyer. And it was named as C2A. C2A was initially formed as was meant to be a club for the wives of chartered accountants. And Usha Rani Sridhar, who is the better half of the affable and effervescent chartered accountant Sitapati Sridhar, is the founding and first president of our club. But soon, C2A became a lively association of singers, artists, teachers, chartered accountants, and not to forget the humble homemakers. Together, we all decided to communicate to achieve, and that is what C2A stands for. The word Toastmasters was coined by an American, Dr. Ralph C. Smedley, who was instrumental in finding the Toastmasters International. It derives its name from the phrase raising a toast, which means raising your glass and expressing a wish of happiness or success. At C2A, the various members in the first year itself were able to compete at various levels, like the club, area, and division. And in its maiden year, C2A also had the honor of becoming a distinguished Toastmaster club after achieving major goals in educational and membership areas. There is generally a misconception that Toastmasters is all about writing speeches, making speeches, and giving speeches. Write, speak, speak, speak. But no, that is a myth. Toastmasters offers much more than that. Toastmasters, in fact, provides numerous opportunities to take up leadership positions, to organize and execute events successfully. It is a very good organization for one's personality development that can improve a person's confidence and also stage presence. There will be a video presentation later on in the meeting wherein various members of C2A have accounted how joining Toastmasters has changed their life. To move ahead and continue with our success, I, along with the ExCom of C2A, extend our hands to each and everyone in this beautiful gathering to join us. Come, join C2A, and we all can communicate to achieve together and more. I also take this opportunity to thank the BCICI Chairperson, CA Ajay Kumar, and today's event coordinator, CA Roanna Mirinda, for providing me this opportunity to speak in in front of such a beautiful gathering. Thank you all and have a nice evening.
Thank you, Ms. Maya. Thank you for your wonderful words. Now let's hear from our chairperson of BCICI, CA Ajay, as as most of us know, he's already in line with the theme of the month. He's one of the most fittest members of our club. So, CA Ajay, please.
No, you are not audible,
You're
Ajay.
on mute.
Okay,
You are not audible.
I switched on. I realized that. So, okay, thank you, Sia Natasha. Thank you for the address. So, respected chief guest of the event, Dr. Manal Al-Alawi, Assistant Under Secretary of Primary Care, Ministry of Health. Respected speaker of the day, Mrs. Salva Fadal, clinical educator and trainer from the American Mission Hospital. Mrs. Maya Sharma, President of C2A Toastmasters Club. I don't know, Mrs. Sridhar, Reena Sridhar is here, but Mrs. Reena Sridhar, President of Indian Ladies Association, our mentor of the month, C.A. Surinder Jain, other mentors, members, invited guests, good afternoon to all of you. So as is most known to most of us, I think October is marked as the Breast Cancer Awareness Month. And I am happy to see a lot of the participants have, heeded to our request and have come dressed in pink. By doing this, you are showing your solidarity with the women who are currently suffering from breast. So as with most diseases, I think early detection is the key in fighting a successful battle against this disease. And this is where the awareness is an extremely important part of the activity. And today's event is a very humble effort from the BCICI to raise awareness on this important topic. Of course, I will leave the floor to the expert speaker to cover more in details. But before I go, I think I need to thank a few people for making today's event possible. Firstly, I would express our gratitude to Dr. Manal Al-Alawi, Assistant Under Secretary of Primary Care, Ministry of Health, who has taken valuable time from our busy schedule to be with us today and support us in our efforts, and will share her thoughts later. So thank you, ma'am.
Thank
We
you.
are also fortunate to have Mrs. Salva Fadal, clinical educator and trainer from American Mission Hospital, for agreeing to speak on this topic. And we are hoping the participants will benefit from her session and her vast experience as a trainer. Thank you, ma'am, and we look forward to your session. We thank Mrs. Maya Sharma, President of C2A Club, who collaborated with the women's wing of BCICI to make this event possible. I was in the same Speechcraft program that Maya was referring to earlier, and now I can see that she's an accomplished speaker. So having heard her speak, you must have already realized the power of being part of a Toastmasters Club and how this helps in public speaking. So I would highly recommend any of the women members who are interested to improve their public skills, speaking skills, you should consider joining the C2A Toastmasters Club or any other Toastmasters for that matter. I would express our appreciation to Mrs. Reena Sridhar, President of the Indian Ladies Association, who helped spread the word among their association members so that this session benefits a lot more people. So thank her for that. And I especially thank our mentor of the month, CA Surinder Jain, for being the guiding force for us during this month, as well as connecting us with the chief guest today. Thank you also to CA Ankush Malhotra from AMH, who along with our dynamic ExCom colleague, CA Rowana, planned the whole event and made this session possible. So I also thank all the ladies as well as the gents who have joined us today, as it is an important topic for everybody, I think, and hope you get some value and from today's session, and this benefits all of us. So with that, I would hand back the control to Sia Natasha to take the session forward. Thank you.
Thank you, CA Ajay. Now, as CA Ajay mentioned, we are very honored to have as our chief guest today, Dr. Manal Amin Alawi, Assistant Under Secretary of Primary Care, Ministry of Health. Dr. Manal, thank you for joining us, and please let us hear from you.
Thank you very much. Well, good afternoon, everyone, ladies and gentlemen. I am Dr. Manal Al-Alawi, Assistant Under Secretary of Primary Healthcare in the Ministry of Health. Thank you for inviting me today to be part of this important event. As most of you know, that October is the Breast Cancer Awareness Month. It will be celebrated under the theme Give Hope, Stay Alive this year. We are aiming to increase attention to early detection, treatment, and palliative care of this disease. Breast cancer is the first common cancer between women in Bahrain. It is the top cancer in developed and developing countries as well. Cancer is the second leading cause of death in Bahrain, as the statistic shows in 2018. With no sufficient knowledge about breast cancer, early detection remains the cornerstone for breast cancer control. Awareness about self-examination, clinical examination, signs and symptoms, impact of hereditary factor will lead to the early diagnosis and early detection that will give better chance for care and promising outcome. Availability of resources for diagnosis and treatment is the main challenge in the developing countries. As you all know, that Bahrain government through the Ministry of Health gave priority for both screening and management of the disease. With your help, with you all, we can support all women that needs help, that needs to be treated, that needs to be screened. Thank you and have a fruitful, informative afternoon. Thank you very much.
Thank you.
Thank you.
Thank you, Dr. Manal.
Thank you.
Now, for today's session on breast cancer awareness, we have as a speaker Ms. Salwa Mohammed Fadul. She's currently working as a clinical educator and training coordinator in American Mission Hospital, and she'll be sharing her insights on the topic today. May I please call upon Ms. Salwa? Ma'am, you're on mute.
It happens
Okay.
to everybody.
You can hear me, everybody?
Yes, yes.
Okay, thank you so much. Thanks for inviting me. My name is Salwa, and I'm a clinical educations at American Mission Hospital for many years. And thank you for inviting me to be involved in this. Normally, every year in October, we will be very, very, very busy because we go all over Bahrain, all social club, all company, and we present all educations on breast cancer awareness. So this is my first time to do it like video. So what I will do, I will give you small presentations. I have got a model here with me just to share it, how to demonstrate the breast cancer, just to raise awareness to everyone, male and female. So I'll share the slide with you. I will be quick. I know it's a short, so please bear with me. Okay, can you all see clear?
We can.
Okay.
Yes.
So I will discuss quick in this presentation. Can you all see the slide?
Yes.
Okay, so I will discuss the breast cancer in general, the causes, risk factor, incident, breast cancer statistic, and breast cancer diagnosis, treatment, what is the woman role, and I will end up with the conclusions. So talking in general about cancer, the definition of a cancer is large group of disease that can start in almost any organ of the tissue in the body. When the abnormals grow uncontrolled. So normally we knew our body full with a cell from head to toe. The cell grow, develop, grow and die, but for a reason till today, even a scientific, they don't know why this cell will grow uncontrollably and they go the other directions. So it invade any part of the body, okay, and can separate and control it to the other organ. So is it breast lump or breast cancer? Many women has got so many breast lump. So even when I used to do the presentations, a woman will palpate or they will touch their breast and they will say, oh, I can feel a lump or I can feel something, which makes them so frightened. But to reassure, a 9 out of 10, which is 90% of all kind of lump are benign. That means it is not cancer. Only 10% of these lumps are cancer. So it could be a fibroadenoma. If you can see the picture here, this is fibroadenoma, maybe a cyst, maybe upset, maybe a fibrocystic cyst, but the cancer is obvious, which is, I will show you more further picture of it. Also very important, a lymph node. The lymph node under armpit, many of lymph node gland. In a normal, this lymph node, it should not be visible or palpable. If a woman feel any lymph under their armpit, this means there is a changes within the chest area. As I said, it is not necessary to say the changes is abnormal. It's only 10% of that. It could be some abnormal growth. So this lymph node carry the blood to the other organ in the chest area. So if it is infected, okay, it means there is an abnormal growth under the arm. So the causes till today, okay, cancer raised from many abnormal cells. The changes result of interaction between person, the genetic factor, external agent. So no one till today knows what is the causes of most breast cancer. It is most likely caused by changes in the genetic material, the DNA. DNA often change related to our lifestyle, related maybe to age or other organ. So the main reason of causes of breast cancer is the changes in the DNA. But there are risk factors that may cause a breast cancer. Some of risk factor we can control, we can change. Some of risk factor is beyond our capability. We can't do anything of it. So the first risk factor is the age. The woman grow more age, she's more prone to get breast cancer. So the higher age category a woman will catch breast cancer will be between age of 45 to 55. But the smallest case in Bahrain diagnosed with a breast cancer, she was at the age of 22, unfortunately. Also the genetic, as I say, is a gene, inherited gene of BRCA2, BRCA1, which now women's aware of it and they turn and they go and check their gene. If they are positive for BRCA1, BRCA2, they go for elective mastectomy. But still that will not prevent them catching breast cancer. They may catch a cancer. It could be in a lymph node, it could be in other organ of the body. Okay, Ginger, being a woman, we are all in a woman at risk. Doesn't mean cancer will not happen in men. Still, okay, 1% can happen in men. And we have men in Bahrain diagnosed with a breast cancer in late stage. The reason it wasn't late because men never thought that they will get breast cancer. So women and men should be aware. Another reason which we can control the lifestyle, modification of lifestyle means smoking, drinking alcohol, obesity, inactivity, the eating habit. This is all put us at risk. It's not only for a breast cancer, for all type of cancer. So tobacco use, alcohol use, unhealthy diet, physical inactivity are major cancer risk factor all over the world. Between 30 to 50%, cancer can purely be prevented by avoiding or controlling this factor. Cancer can reduce through early detection and manage of patients who develop the cancer. And many cancer have a high chance of a cure if diagnosed early and treated adequately. So there are factors that women can control, reduce. I wanted to be healthy not only for cancer, for everything, for chronic disease, exercise. How many of us does have exercise? We all busy, we all work, we always say we don't have time to go to club, we don't have time to go to gym. And now also with the corona, also that really frozen everything in life, but we can do it. If you want to stay healthy, okay, exercise. Food, okay, because of maybe long working hour, because of lifestyle we live now, the way we eat food never used to be like before. People does not go for a healthy food. Fast food, the very quick, all this fluorescent color we add to the food to make it tasty. Alcohol drink, reduce the consumptions. Just radiation, what do I mean by just radiation here? Here, just radiation, anyone who has gone under a treatment of any kind of cancer and went through the just radiation that put their life at risk for breast cancer. Smoking itself is a huge subject to talk about, and overweight. So know your BMI. How many of you knows what is their body mass index and what is the normal BMI? What is normal for myself? So go and ask the doctor. So this is one of the things, a factor I could improve, I could control. Okay, we hear lots of math about breast cancer. People say you drink more caffeine and soda, you will catch a breast cancer. Using of a deodorant, have you heard about it? This kind of a deodorant, that kind of a deodorant, this may cause breast cancer. No, that one healthy, that will not cause breast cancer. Heating food at a microwave, sleeping with a cell phone, contact with someone has a cancer, or even the bra. Women say, I have heard that if you sleep with a bra, you will catch a breast cancer. I reassure everyone, till today, there is no literature, there is no study to approve that using caffeine, using deodorant, heating food at microwave, cell phone, contact with someone, or using the bra, especially with binder, will cause a cancer. Only what I have read saying deodorant, if you read the ingredient of a deodorant, if it has 0.006 of aluminum, it may put your life at risk. But till today, there is no study to say it will cause a cancer. So just be reassured of using that. You can use it safely, better not to use. Okay, talking about the incident, I used to give this lecture. I have been doing this for the last 20 years, and I remember very well. We used to say maybe 5 years back, 1 woman in 10 will get a breast cancer. 3 years back, we're telling people 1 in 8 will catch breast cancer. The incident is increasing. It's really horrible. But always there is a hope. It's not to frighten everyone. 98% survival rate will increase if it is detected early, where 27% only survival rate if it is late discovery. And I say for men, 1% also can catch a breast cancer. So what do I mean by discovering early? There are stages of breast cancer at the presenting. So if it is 0 stage, mean it's an abnormal cell only inside the cell, and discover early by maybe by mammogram, okay? So the survival rate will be 100%. If it is a stage 1, 98%. Stage 2, the cancer in the breast tissue and less or more than 2 inches. And a cancer may also spread to the underarm or to the lymph node. So the percentage of survival is 88%. Stage 3, the tumor is larger than 2 inches and it's excessive, spread to the underarm or nearby lymph node, possible dimpling, inflammation changes, or skin changes occur. So the survival rate will go down to 52%. And as you see, stage 4, which is metastasis to other organ of the body, the survival rate will be only 16%. Breast cancer statistic. Breast cancer is one of the most common cause cancer in Bahrain, 33.5 on all other malignancies. The rate of breast cancer among women in the Kingdom of Bahrain is 44.4 per 100,000 women. But the scary is Bahrain has got the higher percentage among all GCC countries. Look at Bahrain. The size of Bahrain compared to maybe Saudi Arabia, compared to any. Why we have a higher percentage among all the other GCC countries? So it's really a scary statistic. Average age of diagnosis is around 47, as I says, 45 to 55. For Westerner is the 54, and this is according to the WHO. Now, if you look at the latest statistic from the WHO, World Health Organization, in 2020, look at the statistic of percentage of cancer global. Okay, number 1, I don't know whether you can see this clear. Number 1 among all over the world is lung cancer. This is the rate, percentage 11, and this is the mortality rate, the die because of lung cancer. The number 2, okay, come breast cancer, which is really scary. This is internationally, and this was from 2020. It was in 2018 latest statistic, but they have got this stat in the World Health Organization. Now looking at Bahrain, population of Bahrain, number 1 cancer among Bahrain population is breast cancer. And this is the death rate. See the percentage? 21.7 is a breast cancer. Then, of course, after that come the bladder, then colorectum, then the leukemia, that is blood cancer, lungs, and other cancers as go in the list. So we're looking at the future, look at the past, and look at the future statistic. In 2012, there were 177 cases of cancer in Bahrain. In 2018, 227. And look at the estimated by 2040, there will be 480 women diagnosed with breast cancer. So women, be sure, be aware of yourself, okay? Looking at also literature and study, there were a study conducted by Dr. Amal Rais, is a surgeon from Salmania Medical Center, and it was in 2017. She stated in her study 250 cases breast cancer diagnosed at that year. This is only at Salmania. Imagine for the other organization or other hospital. So her suggestions, looking at Bahrain figure, what we need to do, we need to go for further research and study to find out why Bahrain among the GCC country has got the higher percentage. And hopefully we can do, hopefully we can look for it, to discover it, to make women more aware, make them more educated. So how the breast cancer is diagnosed? Breast cancer, of course, they do investigation. We will have factors fast, mammography, ultrasound, MRI, magnetic resources, and fine needle aspiration where they take a sample from the lab. Treatment of a cancer, it depends on three things. Stage, at what stage? The cancer cell, the type of cell, whether invasive cell or inside the cell, and the desire of patient, of course. That is the most difficult thing. So what do women do when she discovers breast cancer? So treatment, they go for surgery, radiotherapy, chemotherapy, hormonal therapy, targeted therapy, immunotherapy, and biological therapy. It's a long, long process and a painful treatment steps. So what do you need it to do? Woman, be safe, be sure. Again, be safe, be sure. How to do that? You have to continue self-breast exam. Woman should get to know herself, should get to know her breast, should know fast the changes that happen at her body and report it immediately. I'll give you an example. Many of my lecture, after I finish, I get women come back to me at the side and say, by the way, one time I had discovered a small lump under my arm. Do you think this is normal? I says, why are you reporting that now? Did you ask anyone? Problem is culture. Woman does not speak. Don't wait for someone to come and speak to you and then open your mouth. Always go and find out. Always ask the doctor, ask the professional. So how breast self-examination woman must do it? Women must do that from the day, not the first day of a period, from day 3 to day 10. Not before, not after. Because before the period, all the hormonal changes, okay? And of course, after the period, women go into ovulation. So wait for the period to come. Day 3, 4, 5, 6, 7 are this day to touch the breast because the hormone subside, goes back to normal. The tenderness and the painful will not be anymore there. So it will be easy for women to find out the changes within her breast. And it is not easy. It is not possible that a woman say, yes, now I knew it. It takes you time. It's a new task assigned to you. So it's not from the first month. I don't think from second, okay? Maybe a woman will take her 6 months in order to be familiar. It's okay. You may escape few months. Woman who does not have a period anymore, I always say to women, do it on your payday. People will not forget the salary day payday. Or mark the calendar, day 1 in a month I will do it. Day 1 or day 3 in a month I will do it, okay? Visit your doctor. So one role is get to yourself, breast self-exam. Day 2, that is from age of 20. Task 2, all women should visit their doctor annually. You visit your GP and do annual check from head to toe. It's not only breast examination, cervical examinations, your hemoglobin, your vitamin D, anemia or not anemia, Okay, you ensure of your health fitness. Go and check your body mass index to be aware whether I'm obese, I have overweight, I'm at risk, I do have a problem. Okay, regular mammogram at the age of 40, of course, all women should go for annual mammogram. If a high risk means somebody close in the family catch a breast cancer, woman should do it once in a year. If not, she's normal, she's fit, she can do it one every 2 years or 3 years, depending on the doctor she consults. But you look at the researches. Researches does not show a clear benefit of physical breast examination, neither for a woman herself or even healthcare professional. They're saying even if a woman, she examines her breast every month and she does it the right way, she's sure, she may miss the lump. It's not easy to palpate the lump, especially if it is deep lump, even healthcare professional. But woman knows themselves. If you have got a spot, small spot in your face, you will notice it easy. You will be thinking, oh, when this spot will go. The same things you should be aware of your entire chest. So any changes with your breast, you only will know it. You only will report it. What we want you to do, we don't want you to report that late. Okay, as early as possible. Get to know yourself. Report any changes, any unusual changes. So what the changes? So breast self-examination, I have got the model. I will show you quick on how to do it. You, first of all, you do the visual check. Stand in front of the mirror and look at the entire chest, okay, by putting your whole hand on over your head or by your wrist, and look at the underarm, look at the entire chest, look at the nipple, get familiarized with the shape. Number 2 is palpation. First, you look at the both breasts, visual. Number 2 is the touch. Under the shower or by lying down, okay, you make your hand soft. You put oil, you put soap, because skin to skin is very tough. So you need something flexible to make your hand move. So you can do it either from in to out or out to in, or you start from underarm going around your breast or up to down, down to up. I'll show you soon on the model. So when you look at the visual, this is an excellent picture. I want you to concentrate on it because women will never look at their breast. I had asked so many women in the culture outside, did you look at your breast? They were laughing. Why we have to look at it? And I says, in order to become familiar, in order to know the changes with your breast. So what do you look at it? Look at it and concentrate. Is there any feeling of a thick area suddenly, aside from the breast become thick? Dimple, one side of the breast become dimple. Changes within the nipple crust, redness, crack. Is there any red or a hot at one spot from the skin of the breast? Suddenly unexpected fluid. This is not for a woman who has, some women, they will have hormonal imbalance. They will have a spot of milk or a spot of a clear fluid when they squeeze the nipple. If they know themselves, it's fine, but not something that just happened today. That is what she should be really aware of it. Skin sores, a source comes on the skin. Sudden grow bump, you see small bump coming outside from the breast. Sudden growing vein. Normally when you look at your breast, you will not see the vein. Now all of a sudden it visualize. You can see clear the growing vein. Sunken nipple, that nipple goes inside directly deep. Okay. Oops. Sudden changes, asymmetrical changes within the breast. Okay. We always worry when all of a sudden one size of a breast becomes smaller than the other. It's not the other way. Many women will say, my right is bigger than the breast. But if it is from the beginning, it's okay because you work, if you're right hand, you work so much on your right hand, but not suddenly happen the changes. Okay, look at the skin here. We call it orange peel skin. The skin of the breast, the color has a spot and become like orange, like the orange color. Okay, when you palpate, you will feel hard the lump. When you touch the lemon, you can feel of the piece of it. So this is what you look at when you do the visual check. So any changes that was not there, that's something new, you have to report this immediately. Of course, you need to visit your doctor regularly from the age of 20. You will start to do my full health check. So mammogram, I said mammogram from the age of 40, women should go for a regular annual mammogram. So what's a mammogram? Mammogram is an X-ray picture. It's specific for breast. The doctor uses it to look at early signs of breast cancer. Of course, what they do, they put the breast in a machine and they squeeze. It's a little bit painful, but it takes 15 to 20 seconds. You won't even feel of that much pain, okay? So the examination will breast you in the machine, and they're saying it is less harmful than this radiograph. Lots of women will say, I don't want to go through this mammogram because they say the radiation from mammogram, it causes cancer. I have heard this, but no literature to say mammogram will cause a cancer. Since mammogram is the only X-ray that can detect breast lump, does the woman have an option? No, it is your choice. So to discover the lump at this size spot or at this size spot. So it's a decision of a woman. It's very important to start mammogram as prophylactic. So woman, what you need to do, you need to know your breast over a time. You need to be aware of yourself. You need to be aware of the changes that takes place in your body. Look at your breast when you change your clothes or feel your breast, for instance, when you are take bath. So you don't need to look at every night. You don't need to touch your breast whenever you have a pain. You don't need to touch your breast before you go to bed. It's only once a month. And you know the right time to do it? Between your period. No period, day, or any day of the month. Look at the changes that seems unusual for you. If you find unusual changes, immediately you need to see your doctor as soon as possible. And ask about the doctor when I should start mammogram and how frequent I should do mammogram according to your history. They will ask you this. If possible, change these risk factors that you can change, that put you at risk. Obesity, lifestyle, smoking, alcohol, the diet we eat. So how to reduce the cancer? Modify and avoid, as I say, the risk factor. It's the same slide. So being overweight or obese, think of it. Unhealthy diet, which has low fruit and no vegetable intake, lack of physical activity, alcohol use, sexual transmitted disease. So it's very, very important for you women to do also not only breast exam, to do pap smear, to do tests for the cervical. Because if it's a high risk, if any changes within the pelvic area to the woman, that put their life at risk. Infection of hepatitis or other carcinogenic infection, ionizonic or ultraviolet radiation, a woman who go for sun bath or go for coloring, change the color of their skin, that also put their life at risk. And European air pollutions, I'm sorry to say that I know this is very difficult to change, especially here in Bahrain, we have so many air pollutions. Factory is very close to the village, so that's why it's put the woman at risk. So indoor smokes from household use of solid fuel. So at the end, we invite God to enjoy a life filled with health and wellness. What I wanted you, woman, again, be sure, be safe. I'll end this slide, okay, and show you how to do the breast exam before we finish this presentation. Can you see this clear? So what I want you, this is the size of lump, okay? If you look here, this is spot, it's 0.4 centimeter. This size and this size can be discovered only when a woman goes for mammogram, regular mammogram. If a woman goes for mammogram, she can discover it. As I say, the lump discover early, the survival rate go higher here. The survival rate go low when the lump discover very late. If a woman has breast cancer at this time, it may stay on her body for 5, even 10 years till she discovered by accident. Okay? If a woman does a regular mammogram and she's aware of any changes that happen to her body, she may discover it at this size or that size. And this is the worst, which is by accident. So how to do the breast exam? It's easy, simple demonstrations. Can you see the model? Okay. So what a woman need to do? She need to start from underarm. Why underarm? Underarm, you need to feel for the lymph node. I say normally the lymph node should not be visible, should not be palpable. You have to use the 3 finger here, the middle of a 3 finger, okay, in a circle motion. So how you do the circle motion? First, you go light, come down, go deep, and then deeper, okay? Slide your finger all over the entire breast. So go light, and then deep, and even deeper. So you go all over the breast in a circle motion without missing any point, without missing, okay? And again, come up, okay, come all over the breast. You see, there is a lump here, which is easy. You can visual, you can see it. Go all over. And when you come to the nipple, it's advisable that squeeze the nipple. You have to squeeze it, okay? Because sometimes there is a fluid, but the fluid not visible. So in order to see it, you need to squeeze. So always use right hand for the left, and then the left hand for the right. I did the other way because this is heavy. Okay, you can do it up and down and up. Okay, we're going, or you can do it in and out, in and out. Okay, so see which is convenient for you, you do. Now it's advisable also not only to touch the entire breast, even the underclavicle bone, the bone here. Keep your hand inside and feel deep. And when you do underarm palpation, you should come all entire underarm up to the elbow. Feel it up to the elbow, okay? All entire breast. So this is the exam. And I say, if you feel of anything, a doubt or something that was not there before, immediately you need to go and report to the doctor. That's it from me. So if you have any questions, just feel free to do it. Thank you so much. Hopefully it was benefit. The time, normally I will speak more than that, but I know the time respect the timing of everyone.
Thank you, Ms. Salwa, for a very informative session. If anyone has any questions, please ask, or if you want to put it on the chat, I can read it out for you. And I'll give it some time. So, okay. So we can go into the video presentation from Priyanka Purohit, member of C2A Toastmasters Club. If you have any questions, you can still put it and I'll take it up later. But yeah, Priyanka, you can start.
Thank you, Natasha. Good evening, everyone. I am Toastmaster Priyanka Purohit. I am Vice President Membership of C2A. And here is a video of what a few C2A members has to say. So I would like to present it.
Hello everyone. My name is Shraddha Rogde and I am part of C2A Toastmaster Club. C2A means communicate to achieve. This is all women Toastmaster Club and all the club members and mentors are very helpful. They help you to achieve your target of being a successful public speaker. After joining this club, it helped me to regain my confidence that I still can go on stage and deliver my speech successfully. Within 1 year of joining this club, I won the club level competition and area level competition. I also have completed my level 1 of innovative planning pathway. So if you also want to become a successful public speaker, let's come together and communicate to achieve. Thank you.
Friends, honestly, I was a very shy girl. Never volunteered to speak to a group of people. Frankly, I would run away and hide myself in such situations. Though my parents told me to join Toastmasters, I didn't show any interest. After I quit my job, I joined C2A Toastmasters for time pass. What a tremendous difference it has made in my life. My confidence level has grown so high to face people. Totally obliterated my stage fear. Now I enjoy and look for more opportunities to speak out. A complete transformation in me. Outside the club, people say to reduce my talking. Friends, what are you waiting for? Join Toastmasters and change your life.
Toastmasters is not only about public speaking. It is also about building one's listening and leadership skills. It involves expressing yourself the way you want and exploring those aspects which are hidden somewhere in each one of us. Mine is a classic example. From a big no to Toastmasters to getting involved in forming the C2A club, which is a women's only club, and all our members have a great sense of belonging and support for each other. At C2A, our focus is on creating a fun-filled learning experience for all the members. Toastmasters is not a one-way road. It's a two-way street. So come, join C2A so that we all can learn and grow together and become better.
Welcome to C2A Toastmaster Club. My co-TMs Varunika, Shraddha and Nisha have articulated how joining Toastmasters have immensely benefited them personally and professionally. This small but a courageous step connects you to the world of communication, leadership and lifelong relationships. Why courageous? Because fear of public speaking has been consistently recognized as the biggest fear. Anyone overcoming that fear through joining Toastmasters movement have seen their life changing. Whether you are a young professional looking to advance your career or someone hoping to make an impact in your community, Toastmaster is the most supportive, enjoyable and affordable way of gaining great communication and leadership skills. We have established C2A in 2019 as a female-only club to provide a platform to turn all the worthy, beautiful females into confident female leaders. C2A Toastmaster Club provide all the requisite skills and confidence you need to effectively express yourselves in any situation. C2A with its fantastic, friendly and very humble members and senior mentors from Bahrain's most iconic and prize-winning ICAP Toastmaster Club. You're all welcome to this amazing family. We all would be together in this fun-filled journey of continuous learning.
So that's from my side. And I have one question from Ms. Salva, that as we are a group of women, how we can help a person who is suffering from this disease, and we can do something for them. So please let us know. We would like to help him or her. So over to you, Natasha. Thank you.
Hello? Yes, you can hear me?
Yes.
Actually, the support the woman need at this stage is mainly a psychological support. A psychological to keep her away of thinking, especially when the woman start the treatment. It's not an easy at all trip. So they will be overall psychologically disturbed. So the support, taking them away. So what I had done during one of my sessions, I had one volunteer who undergo breast cancer, and she had a mastectomy, and she stood in front of all the women in the audience, and she spoke about her trip of treatment and how she coped, how she faced it. That give a lot of strength. So you have a group of women, you have an excellent committee Toastmaster. So what you needed to do, if possible, to get in touch with a woman who had gone through breast cancer, get them together, support with them, let them speak, let them come to the public in one of like this presentation and ask them to talk about their experience. This will give them a lot of strength. This will give them a lot of support. When they talk in front of people, they will feel so proud. This is really an excellent psychological support. I would like to include them really in such of these talks, because, you know, when they go through the treatment, all the hustle they experience, they rather to stay in a corner and they don't want to meet anyone. But if you make it open, get one, get two, and strong support, talk and make them strong. Like you, all of you, mashallah, very strong, talk the same way. This is an excellent way of involving them in the community, a strong support. Good luck for your toast. I think I have seen one of the questions also when one of the men asked, is it the same way of examination for men? Yes, it is the same way. Men also needed to use their 3 finger and start palpating in a 3-stage, light, deep, and deeper. And in a circle motion, up to down to up, or side to side, or go into circle motions. Good luck for everyone. Thank you again for involving me, and thanks for the interest. All chat is a very positive comment. Good luck for everyone.
There's one more question. At what age should we think of going for a mammogram? And there is another one which I can combine with that. Should we go for a mammogram even after menopause or hysterectomy?
Okay. For age of mammogram, normal woman should start at the age of 40 here in Bahrain. As you've seen, I have wrote in my slide, you decide this with your doctor, because in Bahrain, they start even before age of 40. If a very high risk, meaning someone from close family member catch a breast cancer, so even from the age of 35, they can go for mammogram. But before that, before age of 40, if they have any doubt, they can do anytime ultrasound. Breast ultrasound is safe. But if they discover or they have a doubt, they are not sure from the ultrasound, directly they refer them to mammogram. Okay, sorry, what is the other questions? Menopause, yes. Actually, from after the age of 60, it is not advisable to do mammogram if they had done before. But if they never done it, even at the age of 60 or after menopause, and they would like, so it's fine. It's okay. It will not harm. Why breast mammogram are not being done before the age of 40? Because the breast is very dense. So the X-ray from the mammogram, it cannot detect the breast cancer, it cannot detect the lump. So the woman, grow more at age, the breast tissue becomes soft. So it's easy for the X-ray of a mammogram to be done at the age of 40. That's why the main reason is not for anything. And it's not danger. As I said, it's the only X-ray that can detect the lump, as I have show you in the manual at a small size.
Thank you very much. All right, thank you, Priyanka, as well for your presentation. And can I call upon Pushpita Chowdhury, another member of C2A Toastmasters Club, for the vote of thanks, please?
Thank you, Natasha. Honorable Chief Guest, esteemed Speaker, Chairperson BCICAI, President C2A, distinguished invitees, guests, ladies and gentlemen. A very good evening to all of you. It is a great honor and proud privilege on my part to propose the vote of thanks on this memorable event. On behalf of BCICAI and C2A Toastmasters Club, I express my heartfelt thanks to our Honorable Chief Guest, Her Excellency Dr. Manal Alawi Al-Alawi, Assistant Undersecretary for Primary Care, Ministry of Health, for sharing great insight regarding breast cancer awareness and joining this meeting in spite of her busy schedule. I wholeheartedly thank our esteemed speaker, Ms. Salwa Mohammed Fadul, clinical educator in American Mission Hospital, for sharing a very detailed and valuable presentation regarding breast cancer awareness, the physiological part as well as the psychological part. I express my gratitude, Madam, for sharing your knowledge with us and guiding us how to go for early detection, which can lead to better survival. I express my thankfulness to CA Chairperson BCICAI for his contribution towards this event. It is a pleasure to express my thanks to Master Maya, President C2A Toastmasters Club, for her presentation and sharing her thoughts on breast cancer awareness as well as the Toastmasters movement. I also thank Toastmaster Priyanka for giving the presentation on benefits of joining a Toastmasters club to be a better speaker as well as a better leader, and showcasing the Toastmasters benefits of Toastmasters through the members of C2A Toastmasters Club and sharing their views. I express my thankfulness to our MC today, CA Natasha, for navigating us throughout this evening. And last but not the least, I express my hearty thanks to everyone who has participated in this great event. I'm sure we have taken the insightful words of Ms. Salwa Mohammed, and we will generate awareness among ourselves, around ourselves, and it will lead, of course, lead to a better future. Thank you very much, everyone. And I give the control back to CA Natasha.
Thank you, Pushpita. So if no one else has any questions, we can close the session for the day. Thank you, everyone.
Thank you, Natasha. Thanks, Ms. Salwa. Thank you, everyone.
Well done, Rohana.
Thank you.
Thank you very much, C2A Club. Thanks.
Yeah, thank you, Ms. Maya. Thank you.
Thank you all. Thank you, Rowana, for coordinating with us and helping us with all the information that we needed. And thank you, Ajay, for promoting our club positively.
Yes.
Hope to have many more collaborations with BCICI.
Why not? Thank you, and thank you for
Okay. So have a good evening, everyone.
Yeah.
Yeah. Okay. Bye.
Thank you.